The topic I chose was from an article published on May 14, 2013 in the New York Times and was written by Angelina Jolie Pitt. Pitt discusses the process she went through after being informed she tested positive for the BRCA1 gene mutation and her decision to have bilateral prophylactic mastectomies. She states the high cost of genetic testing and preventative treatment remains an obstacle for women and that it has to be a priority to ensure all women can access these treatments, whatever their means and background. The significance of this topic on the nursing practice includes the importance of informed consent and the crucial role nurses play in disseminating accurate and current information. The nurse's understanding of the reconstructive process can be beneficial in the care of women facing and recovering from a mastectomy. The need to promote and collaborate between healthcare professionals to assist and support the patients who are facing these difficult decisions. Supporting the woman's decision to undergo a procedure to remove healthy tissue in order to prevent cancer. And to promote racial diversity in research. Patients do not get all the treatment and attention they deserve or need because of the lack of resources. This is a violation of the principle of justice. Despite lower incident rates, minorities are more likely to experience late-stage diagnosis and die of breast cancer due to the limited number of minority patients being referred for genetic counseling, and minorities seeking care in facilities with fewer resources. Is calling the surgery prophylactic or preventative ambiguous and misleading to women? Prophylactic radical mastectomies reduce the risk of breast cancer by 90% or more, but it does not prevent the disease entirely. To uphold the ethical principle of veracity, some are now referring to the procedure as a risk reduction mastectomy. When patients need to make a medical decision, the relationship they have with their healthcare team plays a critical role. Based on the information disseminated, the patient's providers can inadvertently act in a paternalistic way and violate the patient's autonomy. Therefore, we must avoid giving our personal opinions to avoid acting paternalistic and disseminate accurate information to inform the women of their choices. To support the patient's decision to undergo a radical mastectomy in order to prevent breast cancer, it is important for nurses to support the woman's right to self-determination and to establish a relationship with the patients. Establishing a relationship of trust with our patients includes setting aside any bias and prejudice, and to provide information about the risks and benefits when undergoing a radical mastectomy, including the need for multiple procedures and the psychosocial and healthcare needs following the surgery. Nurses should collaborate with other health professionals and organizations to change the unjust structures and processes that affect minority individuals. Nurses need to promote social justice by educating minority women to address these healthcare disparities. Minorities seek care in facilities with fewer resources, which may influence delays, higher incident rates of cancer, and decreased quality care. In order for an organization to ensure social justice and reduce racial disparity, organizations have the ethical responsibility to become accredited. Research is a valuable tool in the healthcare profession. Research must encompass diversity among research participants. In order to ensure that ethics is upheld in research, and to address disparities, we must have processes in place to recruit minorities and protect vulnerable groups. Support for women facing these decisions are affected by social stigmas. This includes society's view of women opting for a procedure to remove healthy tissue. Images in the media that portray what is considered to be the ideal body and the effect this surgery has on the woman's body image. Using the 6-step process of ethical decision-making, nurses can develop a caring response for patients who are considering the risk-reducing mastectomies. Step 1 requires the nurse to gather relevant information in order to make an ethical, informed decision. Step 2, identify the type of ethical problem. Nurses have the moral responsibility to uphold human dignity and self-determination. An ethical dilemma occurs if they consider a preventative surgery unethical and conflicts with the patient's decision to undergo surgery. Step 3, using the ethical theory of deontology, the nurse's professional ethics and duty is to respect the patient's dignity and autonomy. It is the nurse's duty to educate and disseminate information to facilitate the patient in making an informed decision. In step 4, we explore practice alternatives. By collaborating with other health professionals, the patient may be given other alternatives that they may have been unaware of. Step 5, complete the action. In order to uphold the principle of autonomy, it is important for the nurse to support the patient in the choices she makes. This will assist and support her during the surgery, recovery, and reconstructive phases, and the stresses she will encounter regarding the psychological and physical issues after surgery. Step 6, we reflect on the outcome of the ethical decision-making process. This can assist nurses in evaluating if the ethical problems were solved and determine if professional values and morals were upheld.